Every death is very tragic.
With such a high death toll, how can you say that your strategy is working?
Well, it sounds like you want to throw us out of EU.
Sweden's unique trust-based approach to tackling the coronavirus pandemic rejected the strict lockdowns imposed around the world and instead encouraged people to voluntarily social distance. But the policy has come under increasing criticism and pressure. A group of scientists wrote a letter condemning the approach months ago, and more recently, the country's chief epidemiologist admitted mistakes have been made. My guest this week is Sweden's Foreign Minister Ann Linde. With a death toll much higher than its neighbors and borders closed due to concerns over the number of infected, has Sweden made a deadly error? Foreign Minister Ann Linde, welcome to Conflict Zone.
Thank you very much.
You said recently that Sweden's trust-based strategy to combat the coronavirus was working. Your Prime Minister also continues to maintain the strategy was the right one. But to date, you have nearly 5,000 confirmed coronavirus deaths, far higher per capita than your neighbors, who imposed stricter lockdowns early on. With such a high death toll, how can you say that your strategy is working?
Well, actually, we had the same goals as most other governments. That is to save life and health, and also to keep the system in the health service able to cope with this very strong push on the limits. And actually, we managed to flatten the curve. We have never have problems with getting sick people into the healthcare. And actually, also, we have managed to get our people to follow the recommendation, and we also have legally binding measures like social distancing and also washing your hands, don't travel, work from home, all of those issues. What we have not managed to do is to keep the virus out of the elderly care center in specific region of Stockholm and the surrounding of Stockholm. So I would say that it's a tragic for each death, but it's not possible to compare with any country. Some countries who have had complete lockdowns has far more death tolls than we have. So it's actually of no use to do such comparisons.
And I want to talk about that impact on the elderly, which has been so dramatic in your country. But first, I'd like to just pick up on something that you said, because you said that you've managed to flatten the curve. But we have the European Center for Disease Control saying the initial wave of transmission, has passed its peak in all countries in Europe except Sweden and Poland. What does this say about your strategy?
Well,
because
actually,
you have not even reached
and I would like to counter what you're saying there, because that is not true, and that was our state epidemiologist said today, that we have gone far away from the peak. We are going down. But 2 weeks ago, we started a massive testing for virus, meaning that everybody, every single person, if you don't even have the slightest symptom, you can go and test yourself. And of course, that means that we will now have a much greater number of viruses. And that's why it's so wrong just to look at that situation. We don't have any excess of death anymore. We have far more places available when it comes to intensive care. So it's absolutely what you look at. And to listen to our chief epidemiologist, it is not the way that there is a new outbreak or anything like that. So I totally counter what you're saying.
You mentioned that the goal was to save lives, slow the rate of infection. About half of the deaths, however, have been in homes for the elderly, which you've also highlighted, and those over 70 have accounted for almost 90% of all deaths, 90% of all deaths. So when you set out those goals, was it just for the young in your population?
No, we hope that we should be able to also see to that vulnerable groups did not get the disease. But we didn't manage to get it out of our elderly care home. And that is something we really have to look into. In Sweden, many elderly care home is privately owned. There is a lot of precarious work. There is also a lot of people working there who don't even have a monthly salary. They are only there per hour. Many of those didn't stay home when they have slight symptom, and this is something that we in Sweden really have to be to evaluate later.
What was your level of responsibility, though? Because we have the former state epidemiologist Ann Linde saying the following about your handling of this. She says, there was no strategy at all for the elderly. I now understand that. I do not understand how they can stand and say the level of preparedness was good when, in fact, it was lousy. Was there no plan for the elderly?
Well, actually,
that's shameful, isn't it?
Well, it's your words. I think that you are actually acting like this is kind of a World Cup in who get the disease or not get the disease. We don't see it that way. That's not how a responsible government is handling those issues. Actually, what we have in Sweden is another way of governmental organization. We have very much on local level, elderly care is taken care of, regional level, the hospital care is taken care of, and then we have the central level with very small ministries and very big authorities. And that means that if it's not working on one of the levels, then we will have a problem. And that is why the state had to go in and take a lot of decision when we saw what was happening in the locally run and mostly privately run elderly care homes. That means, for example, that we have taken more than 40 different ordinances and also several new laws so that the central level could be able to go in and decide also on other levels. And now we could see that the disease and the transmission of the virus is actually going down in the elderly care. But for example, the regional organization for regional and local authorities stated that there was more than 40% of those who were employed that didn't have enough knowledge of basic hygiene care, for example, how you wash your hand and so on and so forth. That is now being taken care of with 140,000 having got an education.
So let's take a deeper look at why this happened in the elderly care homes, because there have been these horrific reports from news outlets that not everything has been done to save the lives of the elderly. Aid workers in care homes, as you've also highlighted, were reportedly told that they should not send anyone to the hospital for intensive care, even if they were in critical condition. You've mentioned that you're launching a commission to look into the strategy, that you've also launched additional measures, but at the end of the day, it is too late for the families who have lost loved ones. It is too late for those nearly 5,000 who have died. So what do you say to them?
Well, every death is very tragic, and that is, of course, nothing that we wanted to have the coronavirus. I don't think you thought that in Germany too. And I don't think that anyone think that, well, this is something that the government wants for anybody. And that's also the case for our government. We have really tried to work out the best strategy, but we have, like several other countries, very high virus and transmission in a regional part of Sweden, that is Stockholm and the areas around it. And it came into the elderly care homes. And that is, of course, very unfortunate. And that's why we have taken central decision to make it better. And that's why we are now in a much better position. We don't have any excess death rate anymore. And it's going down also when it comes to intensive care and people on the hospital, which we, of course, hope will stay so that there will be no more second wave. We don't know what happened. This was a new virus to everybody.
I'd like to talk with you about that potential second wave, because we have had your chief epidemiologist saying the following about the potential for that. Sweden will see more cases for a period, but in the long term, we hope we'll have better control of the pandemic. He's also highlighted the fact that in the autumn, there will be a second wave. Sweden will have a high level of immunity, and the number of cases will probably be quite low. You say you're in a better position now, but ultimately, I mean, you do have nearly 5,000 dead in the country. There is so little known about immunity and COVID-19. So I'd just like to ask you, where is your science? Or does Sweden know more than all of the other leading researchers in the world?
Well, I don't think anybody knows right now about a possible herd immunity or how long an immunity should stay, or if there is a second wave or a third wave or anything like that. That is not possible to say, because it's the first time in the history of the world that we have this COVID-19 pandemic. We have never had it before, so we cannot know about that.
There has been talk, though. There has been hope for the first vaccine perhaps being on the market by the end of 2020 if trials go well. The EU already signing a deal with drug maker AstraZeneca for 400 million doses. Have you considered that a vaccine could come to the market so quickly? And have you considered that you might be front-loading, or at least with the strategy, you might have front-loaded your human losses without having the science to back up that it's a smart move in the long run?
Well, we have now put 2 billion Swedish crown and the vaccine coordinator, because of course we hope that the vaccine that comes will be a part of a global common good, and it will come to those who deserve it most.
But did you have the right science on immunity?
Well, actually, I'm a Minister of Foreign Affairs, so I don't know if we have the right science of herd immunity or whatever. And I hope that you will also interview the epidemiologist and the Minister of Social Affairs to be more able to discuss those issues.
I'd like to talk about something that you have spoken quite extensively on. The Swedish coronavirus policy was designed on a system of trust. Politicians, authorities, the public, you've spoken very highly about the system of trust, but the latest polls indicate that the following about that level of trust that the Swedish public has in your policy. Only 45% of Swedes have now a fairly high or very high faith in the strategy, compared with 63% in April. That's a pretty dramatic dip. Do you see that as damaging to your relationship with the public and you know, the concept of a stable and a sane and a reasonable Sweden?
No, that is not what we talk about when we talk about trust. You have misunderstood it, unfortunately, because when we talk about trust, that is if people are trusting the politicians and the authorities in what measures should be taken that is not legally binding. And still, after 3 months, more than 80% of the people are following the recommendation. And that is trust. And that is because the Swedish people know that when recommendations come from authorities, that is not some tip that you are supposed to follow or not. You should follow it. And they do, to more than a degree of 80%. That is the trust that we are talking about. And that is very, very good, because for a long time, actually since the 16th century, it has been built on big authorities, small ministries. It's the advice and recommendation of authorities combined with the legally binding measures that is always taking form of a strategy, also this time. And I'm very, very proud that so many Swedish people are actually having a trust, so they are following the recommendation. Then, of course, if they have trust in the political parties or so on, that is a completely different issue.
Let's talk a little bit more about the relationship that you have with your neighbors right now, the state of trust there. Your neighbors, including Finland, Norway, and Denmark, are lifting travel restrictions in the region, but for the most part, they are excluding Sweden due to its higher level of COVID-19 infections. They have concerns. They have voiced them on record. You traditionally have excellent communication and cooperation with your Nordic neighbors. So leaving Sweden out breaks with a long-standing close cooperation. You're the foreign minister. What do you think about being isolated by your neighbors right now?
Well, I'm so glad that we have such an excellent Nordic cooperation. Like we managed to repatriate 8,600 Swedes from all over the world with a very close and good Nordic cooperation. We had Minister of Foreign Affairs meeting every week. We had consular meetings with our consular diplomats every day. And we had a very, very close Nordic cooperation, managed to get everybody back home. We are also, of course, keeping that cooperation now. During the weekend, I had long talks with both my Norwegian and my Danish colleague, and I also have contact with my Finnish colleague. And for example, we are now hoping that everybody will vote for Norway tomorrow, so they get a seat in the council, a Security Council in United Nations. But one thing that is not so very good is the border cooperation, where everybody who has been living, working, having families across the borders have been very, very aware of that we are different nations. In, for example, the north of Sweden, between Haparanda and Tornio, it has been practically like one town, and suddenly now when we were hit differently by the coronavirus, the border was closed, and that will be wounds that will take time to heal.
How about the wounds with your European partners? We also have the EU Home Affairs Commissioner Ylva Johansson, who also happens to be Swedish. She wants EU member states to lift all border checks within the bloc by the end of June. As we mentioned, the European CDC, their assessment is that your wave of transmission has not peaked yet. So that's not happening, is it?
Well, we have to see, because that's the decision from every country themselves, and every country is doing what they think is best. We have, since the beginning, wanted to have a coordinated an EU-wide solution. That would have been the best, but that has shown it's not possible. But I mean, Ylva Johansson was in the government together with me, so we know each other very well, and we speak all the time. So I know very well that they really want to have a coordinated answer. And I think that would have been the best, because now every country has their own reason for why they're lifting or not lifting different border controls. And that is not the best of the time for EU. And for example, different countries, they have export restrictions. Sweden did not have it. And for example, the Spanish Prime Minister said when we couldn't get our medical equipment, Sweden came and helped us to get it free from countries who had put export restriction also on medical
and let's talk about
protective wear.
Yeah, let's talk about that, because you're getting into the economic aspect of this pandemic now. The EU facing the worst recession in its history. It's exposing risks between countries about how to deal with that. You've highlighted some of them. You highlighted on the export front. We have southern states like Italy, Spain. They've been the hardest hit. They have pleaded for aid from the EU in the form of grants and mutualized debt, a plea that you and 3 other nations called the Frugal Four, mostly in the bloc's north, oppose. Now, the EU, of course, it's a union that goes far beyond the single market. It's a union of values, European identities, solidarity. How should this project survive if you and your Frugal Four allies, who together only represent less than 10% of the EU population, tell the citizens of some of the largest countries whose economies are literally too big to fail that you won't support your partners when they need help the most?
Well, it sounds like you want to throw us out of EU. I don't think the other countries want that. I think that the EU really, really wants to stay in 27 countries. And that is what we are planning to do. But, of course, we could have differences when it comes to how you should have restoring of the economical situation. From our part, we have always said that there is a sound and good economy as a basis of everything. And that is also how we are now reasoning. We think that we should have a recovery plan, but we think it should be done in a sound and economically wise way, and that is why we think it should be just measures that is time limited. It should be measures that is controlled, and that is what we will work for in an MFF, that is the budget discussion. Put it together. We are not against to have a recovery plan, not at all, but we want to do it in a responsible way.
So a responsible and a sound way. Let's drill down a little bit deeper into the message that your group, the Frugal Four, has been sending to your European partners in need. Because after 9 countries, including Italy and Spain, as we mentioned, requested financial support in the form of mutualized debt, the Dutch finance minister said the following. Brussels should study why some governments lacked the financial wherewithal to fight the crisis on their own. And in that context, I would like to ask you, I mean, is now really the best time to be taking the high ground in a lesson in fiscal morality, a time when your partners need help?
Well, actually, I think that we should help each other. For example, by keeping the internal market totally open, so you don't put export restriction to anybody that actually need help from other countries. Sweden has been one of the countries who has been most active when it comes to ventilators all over Europe, when some other countries wanted to keep them for themselves, for their national people. We didn't do that. We showed that solidarity. We also showed a lot of solidarity by giving very, very high grants to World Health Organization, the United Nations, the vaccine program, because we think this is a global pandemic that we should fight globally.
So you said that you have expressed a sense of solidarity. You know, one of the chief messages of those who support this mix of grants and loans is that it does indeed benefit all states in the EU. For example, he says the frugal countries benefit disproportionately from the single market and so should swing behind the proposals. And now this is coming from the EU's budget commissioner, who is Austrian. Tell us, I mean, Sweden is an export-based economy. Over 70% of Swedish exports end up in the EU. If the single market burns, so does your economy. So does he have a point here?
Yeah, it's of course the budgetary commissioner wants the EU to have a much bigger budget. He would not do his job if he didn't have that view. But we are saying the same thing we are always saying. We think that EU should have a sound economy. We don't think it should be too much loans, and we don't think it should be mutualized. That is actually now it's against the treaty of EU to have mutualized loan. So this next weekend's negotiation amongst leaders will of course be very, very interesting. And I don't think that they are supposed to take the decision now, but it will be much clearer in what way it will be possible to go, to get a recovery plan, but not to put jeopardy on the EU's economy.
I'd like to ask you, because one of the areas that has come up when we're talking about jeopardy for the EU's economy is this issue of inequality and unequal recovery. Merkel and Macron have warned that allowing some EU countries to recover faster and some stronger would only deepen inequalities in the bloc, hampering the way that trade operates internally. Von der Leyen has also stressed that it's crucial for the recovery to be even. So you even have the fiscally conservative Germans recognizing the need for grants in the recovery fund. Aren't you forcing a more unequal Europe with your approach? Where is the solidarity? Where is the urgency?
I think that a more unequal EU is nothing that anybody wants, and not to have inequality inside the country. That's why I hope that many more countries would follow our example, to have a tax system that is more equalizing the possibility for people to have the same possibilities, both when it comes to job, to education, and to pay more for the common goods. And that is something I think should be a national thing. And there is a lot to discuss there when it comes to inequality inside and between countries. And I don't think Sweden is the country to blame here.
What is your vision then of the EU post-corona? I mean, if the EU can't rise to the challenge now and use this moment for further integration, further solidarity, further consensus coming together, when it's really facing this massive public health crisis and the greatest economic challenge since it was created, then when? When will it become a stronger union?
Well, EU has been managing so many crises during the whole lifetime of EU. I'm quite sure that EU will managing these crises as well. And it will take some time to go back to the economy, to the free borders, to the internal market, but we will manage, as we have done always. I'm not afraid of that. That's nothing I worry about.
Swedish Foreign Minister Ann Linde, thank you for joining us on Conflict Zone.
Thank you very much.